Yes.
Any tips for clotted dialysis lines? Like even after you cath flow, you get, so then it works for like the next hour or two, and then it.
Okay. Okay, so the most common reason that I've seen, and I had to come in and reinsert the CVC, was when the catheter tip is too high up. That's an inserter problem. That's a really good question. Let's start there. The most common thing I see when I'm consulting or evaluating these hospitals is that the catheter tip is way up in the SVC or in the brachiocephalic. That is going to debatably exponentially increase your thrombosis risk. Okay? I can't help that except do a guide wire exchange for a longer catheter. Now, I know of hospitals that they don't even have longer catheters, no options. That's a problem. And so that needs to be, that's a systemic issue. But that's number one. Number two would be that they're not flushing enough. Dialysis nurses know that they're supposed to be flushing with at least 20 ml. But if they have that catheter way up, they might need to do it with 50. But the problem with that is now you might be fluid overloading them because you have to do 50 for both lumens. And it needs to be high pressure. Okay.
For continuous dialysis, how often would you recommend this?
I don't know the recommendation for that, but I would imagine frequently. Yeah, so let's just say if I was coming up and they asked me at that hospital, and let me give you a specific scenario. I see the x-ray and it's really high up, then how long would you say dialysis is for a patient? Just make up a number.
Oh, well, for us, it would be continuous dialysis.
For nonstop. You'd have to do a study on that.
Yeah, we don't have protocol for.
There's no studies on that, yeah.
It's shown to not make a difference.
Yeah.
They're about to release new guidelines on the NIGO guidelines for international guidelines for dialysis. They're supposed to be coming out any moment now, but there is no evidence to show that flushing your CRT circuit a certain amount of time helps improve catheter function. It's about length, location.
Yeah, I think for us it has to do a lot of times with location. It's like the patient's on pressors, the veins are clamped down, there's probably a right IJ, a left IJ, there's less room for it to function. And then I think it also comes down to who inserts it too. I think sometimes they're in a little high and then they're just like hitting the vein.
Yes, very high. Yep.
The best thing for dialysis catheters, quite honestly, especially if you're at a big academic institution, depending on who's placing the line, and always verifying as a bedside nurse the length of catheter they're grabbing per anatomical institution. Because the amount of times I've seen physicians grab a 15 for a femoral